Good afternoon, and thank you for joining the ZOHU call. The webinar will begin soon, so please stand by. Good afternoon, everyone. I'm Ria Guy, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health office, I'm pleased to welcome you to our first Zoonoses and One Health updates call of 2024. Today, February 7th, 2024. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you can disconnect now. Links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2024/february.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1, identify an implication for human, animal, and environmental health. 2, identify a One Health approach strategy for prevention of public health threats. 3, identify a One Health approach strategy for detection of public health threats. 4, identify a One Health approach strategy for responding to public health threats. And 5, list 2 ways to improve collaborative practice across the public healthcare team. Next slide, please. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses, partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The planning committee reviewed content to ensure there's no bias. The presentations will not include any discussion of the unlabeled use of a product or product under investigational use, and CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. And please note, as of January 1st of this year, 2024, you'll need to visit CDC Train to receive continuing education for all new webcast and web on-demand courses. The course access code is ZOHU Webcast. That's ZOHU Webcast. To receive free CE for today's webcast, sign in or create an account at train.org by March 11th, 2024. A captioned video of today's webinar will be posted on cdc.gov/onehealth/2024/february.html. And that'll happen within 30 days. Free CE for the web on demand video of today's webinar will be available until March 12th in 2026. Next slide, please. So before we get into today's presentations, we have Dr. Colin Basler, who's the Deputy Director of CDC's One Health office, and he's on today to share some news and updates. So Colin, over to you.
Thank you so much, Ria. Hello, everyone. Thanks for joining us for our February ZOHU call. Please remember to share the ZOHU call website link with your colleagues from public health, agriculture, wildlife, plant, environment, and other sectors so we can let them know about the live webinars, video recordings, and free continuing education that this webinar offers. Before our presentations start, I'll take a moment to share some updates and resources. As always, you can find links to these resources in today's ZOHU Call email newsletter. And of course, if you aren't yet subscribed to the newsletter, please sign up using the link at the top of the main ZOHU Call webpage so that moving forward, you can get ZOHU Call updates. In today's newsletter, we highlight several recent publications, including a World Health Organization publication titled Futures Surveillance for Epidemic and Pandemic Diseases, a 2023 perspective, and Detecting Mpox Cases Through Wastewater Surveillance in the United States. Next slide, please. We've also included a systematic review of microplastics and nanoplastics in indoor and outdoor air, identifying a framework and data needs for quantifying human inhalation exposures. And there's a link to an updated highly pathogenic avian influenza H5N1 viruses technical report. Next slide. Lastly, for publications, we've highlighted a few more papers, including personal care products use patterns in association with phthalate and replacement biomarkers across pregnancy. Next slide, please. For announcements and resources, we've included highlights in the history of avian influenza timeline 2020 to 2023, and a call for health departments and students to apply for the National Environmental Public Health Internship Program. Next slide. Additional resource highlights include the World Organization for Animal Health, or WOA's, position statement on the use of antimicrobials as growth promoters, and also from WOA, a vision paper for animal health and welfare, cornerstones for sustainable animal farming. Next slide, please. Some February observances that may be of interest include Responsible Pet Owner Month and the National Invasive Species Awareness Week, which runs from February 26th to March 3rd. Next slide. Finally, we've shared several ongoing outbreak investigations, including a salmonella outbreak linked to charcuterie meats and the lead and chromium poisoning outbreak linked to cinnamon applesauce pouches. Next slide, please. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases and find details about ongoing U.S. outbreaks on the CDC website's link from today's newsletter. Our next ZOHU call will take place on March 6th, 2024. Please be attended by the presenter and topic suggestion for further verification, as well as news from your organization to ZOHU call at cdc.gov. That's COHUCALL@cdc.gov. And with that, I'll turn the call back over to Ria.
Thank you so much, Colin. Next slide, please. So you may submit questions at any time using Zoom's Q&A feature. Please remember to include the topic or presenter's name so we know how to direct the questions. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on this slide, and they'll also be on the ZOHU webpage for today's webinar and in today's email newsletter. So now on to the main event. Next slide, please. Today's first presentation is Strengthening Environmental Action in the One Health Response to Antimicrobial Resistance. And we have on the line Dr. Amy Pruden to present. So Amy, please begin when you're ready.
Thank you so much. It's a pleasure to be with you all today. Next slide, please. So it's quite timely that I was invited to speak to you all today because today is February 7, 2024, and it's the 1-year anniversary of this UNEP report that was released, Bracing for Superbugs, Strengthening Environmental Action in the One Health Response to Antimicrobial Resistance. And I was very honored to be one of the co-authors of this report, but I also want to recognize co-authors Teresa Koch, David Graham, Anthony So, and Ed Top. Next slide. So the purpose of this report was to highlight the state of the science of understanding of antimicrobial resistance from an environmental dimension, recognizing that it is a One Health problem, but that the environmental dimension is very important, but maybe has received less attention than the human and animal health dimensions. And this is a figure from the report that illustrates how human and the environment, specifically land and aquatic dwelling creatures, as well as plants and soil, these are all environments where antimicrobial resistance is resident and evolving, and that microbes, they share their mobile genetic elements, which often carry antimicrobial resistance genes. Next slide. So in considering the environmental dimensions of AMR, the report highlights 3 aspects. So one is considering that the microbial world is extremely diverse, and that the environment, especially soil, can be a source of genetic material that could contain antimicrobial resistance genes or mobile genetic elements that could ultimately make their way into pathogens. Second is recognizing that anthropogenic pressures, so for example, antimicrobials are often natural compounds, but they've been mass produced and put out into the environment, that those kinds of pressures can potentiate and aggravate the problem. And then the third is recognizing that there is dispersal of AMR in water, air, soil, and wildlife. So take-home message here is the environment does play a key role in the development, transmission, and spread of AMR. Next slide. So in addition to providing an overview of the state of the science, we also in the report wanted to highlight what are the options in terms of policy. So antimicrobial resistance is an urgent human health threat. So what can we do about it now? And in thinking about this, we thought about it in terms of value chains where actions might be taken. So that includes pharmaceuticals and chemical manufacturing, agriculture and food production, and also healthcare systems. Next slide. So I'm personally speaking to you as an environmental engineer, and so we spend a lot of time thinking about aquatic environments and how to reduce pollution to aquatic environments. And it turns out that aquatic environments are actually pretty central to antimicrobial resistance. So this is actually an illustrative figure from a UNEP 2017 report, which was more broadly focused on environmental problems, and antimicrobial resistance is one of those problems that they highlighted with this schematic. So you can see that water receives runoff from livestock operations. It can be contaminated by aquaculture, from industrial inputs, and of course from wastewater treatment plants. Next slide. So speaking of wastewater treatment plants, I think this group is familiar with the concept of wastewater-based surveillance. And with the COVID-19 pandemic, we saw interest in monitoring sewage as a way of gauging public health markers to really explode. And so at that time, we wrote this opinion piece to talk about the opportunity of building on the infrastructure that has been established for monitoring COVID-19 and sewage for monitoring AMR. Next slide. So in essence, people consume antibiotics, antimicrobials. We carry resistant organisms in our guts, on our skin. These organisms will end up at the wastewater treatment plant. And you can also measure the residuals of the antibiotics themselves in many cases. And so there's really an opportunity for this kind of sewage surveillance to give us a sense of what communities are carrying in terms of resistant organisms and resistance genes that might help with targeted medical interventions, and also generally to evaluate policies at various scales, at community, regional, national scale, to see if they are effectively reducing carriage of antimicrobial resistance among microbes. Next slides. And this is an example of a study we recently published where we had the opportunity to send students around the world, sample a cross-section of wastewater treatment plants, extract DNA, sequence that DNA using metagenomic sequencing, and compare the sequences to public databases of antibiotic resistance genes. And we saw a quite striking trend of the highest levels in the sewage treatment plants that we sampled in Hong Kong and India, and the lowest in the plants we sampled in Sweden. And I think it's more than coincidence that the lowest numbers of resistance genes were found in the Swedish sewage, where we know that the Nordic countries have been very proactive in enacting policy to combat the spread of antimicrobial resistance. Next slide. And just so this audience is aware that this is an ongoing national and international conversation. How can we coordinate surveillance of AMR? And so sewage surveillance is one approach to doing that. But basically what we urgently need is a way to harmonize surveillance across One Health. And that's going to involve selecting targets that are consistent, measurements, methods, standard methods. And for antimicrobial resistance, this is challenging because it's not one organism. It's hundreds of different bacteria that could be resistant. We also worry about fungal resistant and resistance of parasites. And then there's many thousands of resistance genes. And so it might take a combination of culture, DNA sequencing, whole genome sequencing, and targeted quantification of genes of interest. And I know this is a national conversation, but also internationally, the quadripartite organizations are quite active in this space. Next slide. So in addition to wastewater as kind of an example environmental dimension of antimicrobial resistance, I wanted to highlight potential for monitoring within the food production sector. So this is a project that we had funded by the USDA, in which we were actually able to track the effects of antimicrobial use from farm to fork. So here at Virginia Tech, we have a vet school where we're able to do animal studies. And so we actually had dairy and beef cattle that we administered antibiotics according to standard practice, and then had control cattle with no antibiotics, and then tracked their manure all the way through composting or not, soil application and growth of different crops. We looked at radish and lettuce as two model vegetables, and then we also looked at the effects of produce washing. Next slide. And so this is just an example of one of the many studies from that project where our postdoc Giselle Garone grew radishes and lettuce at greenhouse scale and compared manure as a fertilizer and compost as a soil amendment versus a chemical fertilizer. And there's a lot of considerations here, you know, not just for One Health, but also sustainability, right? So, you know, ideally, we want to use the residuals from livestock as a fertilizer rather than chemical fertilizers. And so this was an important comparison. Next slide. And this is just one example of what we were able to see from DNA sequencing. So each of these points represents metagenomic sequencing and comparison of databases of antibiotic resistance genes that were detected on these different radish samples. And the labels refer to how they were grown, whether it was a silty clay loam or a loamy sand, and whether it was fertilized with In green, you see circled control dairy manure at the bottom, and at the top, DA antibiotic dairy manure. And what's really fascinating here is that all the way at the level of growing the radish and then analyzing the microbiota of the radish, we could tell a difference in the kinds of antibiotic resistance genes that were carried, depending on whether the manure that was used to fertilize the soil came from cattle administered antibiotics. And then in blue, you can see that's the control condition. So both of those were distinct from the control chemical fertilizer. Next slide. So in terms of going back to the value chains, there are a lot of options here that we can talk about in the panel discussion, but basically in agriculture and food value chains, it comes down to reducing antimicrobial use, and that's going to reduce output to the environment. Next slide. Next slide. Pharmaceutical manufacturing, working towards responsible manufacturing processes that reduce outputs to the environment. There have been some example headlines of pharmaceutical companies located in parts of the world with poor environmental regs and outputs of high concentrations of cocktails of antibiotics. And that's definitely something we want to avoid. Next slide. And then within healthcare facilities, I mean, obviously there's a lot of work on optimizing antibiotic prescription practices and stewardship, but thinking about things like the hospital wastewater itself and perhaps some on-site treatment would be warranted. Next slide. And so just bringing it home, I do hope that you take time to visit this report, because a lot of thought went into it in terms of, again, not just the state of the science, but what can be done about it, because this is an urgent health threat. And clearly, you know, both clinical, environmental, One Health surveillance is going to be essential towards stemming the spread of AMR. Next slide. And so thank you, and I look forward to some discussion.
Thank you so much, Amy. What an exciting presentation to highlight some really interesting and meaningful work, including by students, applying modern and innovating technologies, and all the while using the One Health approach to combat antimicrobial resistance. So thank you very much. Next slide, please. So our next presentation is titled Analysis of Dog Serologic Data Reveals Critical Insights into the Epidemiology of Human Coccidiomycosis, 2012 to 2023. And we've got Dr. Jane Sykes here to present for us. So Jane, please begin when you're ready.
All right, thank you very much, Ria. Can you hear me?
Yes, we can hear you.
All right. Well, hello everyone. I'm going to talk to you about my work on valley fever, which is a serious fungal disease of humans and animals caused by the soil-borne dimorphic fungus Coccidioides. And in addition to humans, dogs, horses, camelids, and marine mammals are particularly susceptible to this infection. And the fungus exists in soil as chains of arthrospores, and the spores are inhaled by animal hosts and form these interesting structures in the lungs known as spherules, which I think look like the cut surface of a pomegranate. In some hosts, lung infection may be followed by dissemination to tissues such as the bone, skin, and brain, as shown on this slide. The main endemic regions for valley fever currently recognized in the US are Arizona, southwestern Texas, and California, but disease also occurs in New Mexico, Utah, and Nevada. And these regions are characterized by hot summers, low elevation, and semi-arid to arid soil. Next slide. Outbreaks of valley fever often follow soil disturbance, such as following dust storms and construction. Desert rodents are thought to contribute to establishment of the fungus in new regions. They're thought to become infected move to these new regions, then die, and then the fungus converts back into the infectious form in the soil. A spike in case numbers in people often follows what we call climate cycling, or periods of increased rainfall which accelerate growth of the fungus in the soil, followed by high temperatures which promote aerosolization of the spores, which are then inhaled. And this phenomenon is often referred to as the grow and blow phenomenon. Next slide. So with climate change and population growth, one climate niche model has predicted that by 2095, the disease could spread to encompass the entire western half of the United States, as shown in these maps. And with that, the economic cost of the disease to the country was estimated to increase from around $4 billion per year to nearly $19 billion per year. So it's really critical that we have good tools to monitor this type of predicted spread so as to implement appropriate prevention methods. Next slide, please. The CDC receives currently between 10 and 20,000 reports of the disease a year. However, it's been estimated that the actual number of cases may be 33-fold higher. Over the last 5 years, there's been a progressive rise in human case numbers, mostly because of an increase in reported cases from California. The spike in case numbers shown on this graph between 2009 and 2012 was thought to result, at least in part, from climate and environmental factors that promoted the grow and blow phenomenon. Unfortunately, we have a lot of gaps in our knowledge of the epidemiology of valley fever in humans because of states that do not participate in reporting, as shown in gray on the map on the right of this slide. Next. In 2013 came the first description of valley fever in people from southeastern Washington state, a region that has conditions suitable for survival of the fungus. The authors of this report also stated that before human cases were recognized, the Washington Animal Disease Diagnostic Laboratory had diagnosed valley fever in 2 dogs living only in the area, as well as a horse. Dogs may be exposed more than humans because they're close to the soil and they like to dig. In this case control study of dogs shown on the right of this slide, seen at UC Davis, dogs with valley fever were actually 7-fold more likely to dig than control dogs. Serologic test results from those dogs in California and also in another study from dogs in Texas have been able to identify possible regions of endemicity using GIS mapping of zip code data. Next. So for this study, we hypothesized that serosurveillance efforts in dogs would provide insight into the epidemiology of valley fever in humans because of dogs' proximity to the soil, the high proportion of dog ownership, which is currently estimated at a whopping 45% of households, and the proximity of dogs to humans, reduced travel relative to humans, and also the importance of serologic testing at very specialized laboratories for diagnosis, and only a few laboratories do this testing. We also hypothesized that spatiotemporal analysis of serologic test data would correlate with findings for humans where known and reveal emerging regions of endemicity. And the overall goal of our work was to demonstrate the value of dogs as sentinels for human disease. Next slide. So we gathered serologic data from all laboratories that, to our knowledge, perform serologic testing for coccidioidomycosis in dogs using agar gel immunodiffusion. We obtained data from January 2012 to August 2023. And information requested included location information, at least a county level, state, month and year of testing, and test result. The data, which initially comprised over 2 million visits, were then cleaned to remove results from other animal species, serially tested dogs, and non-serologic test data such as PCR results, leaving results for 887,764 dogs for analysis. Next. So we created graphs of annual data for total tests, test positivity, and incidence per 10,000 households. And annual incidence data were overlaid with available human data for California and Arizona. Because we only had access to annual data for humans for Arizona, dog data were aggregated annually for statistical analysis. And finally, maps of these data and a hotspot analysis were made using ArcGIS Pro, and we also made maps using R. Next slide. So the overall test positivity rate was really high at 37.3%. As you can see, most dogs were tested by 2 laboratories of the 7 laboratories that we obtained results from, but there were still thousands of samples that were coming from other laboratories. Next slide. This graph shows you the number of dogs tested for each year of the study, with positive results in blue and negative results in red. The number of tests increased over the study period, peaking at around 100,000 test results per year between 2020 and 2022, with 2023 being a partial year. The green line is the test positivity rate for each year. There was a highly significant difference in test positivity rates across the study period, with the highest being 41.2% in 2018 and the lowest being 35% in 2013. Next slide. So these are selected maps for total tests and test positivity rates. The number of counties performing tests increased from 5.3% of US counties in 2013 to 20.5% of counties in 2022. Positive cases were reported from 3.3% of US counties in 2013 to 13.4% of counties in 2022. Many of the counties with high rates of test positivity, shown in the right in dark red, actually had very few cases, as illustrated by diagonal line shading, which indicates 3 or fewer cases. So those were likely dogs with a history of travel to endemic regions. Note that test positivity rates tended to be lower in endemic regions where a large number of tests were performed, likely because of a high index of disease suspicion. Next slide. These graphs show incidence curves in the southwestern states where we had the highest case numbers over the course of the study. If you look at the y-axis in the top left, you can see that the Arizona incidence rates were 100-fold higher than they were in California and 100 to 1,000-fold higher than in other southwestern states. A 2018 incidence peak was detected in Arizona, California, and Texas, with a second peak in Arizona in 2021. Interestingly, overall incidence rates in Nevada and New Mexico exceeded those from California between 2019 and 2023. In general, rates in Colorado, Oregon, Utah, and Washington were low, but increased over the course of the study. In Texas, incidence was low, but remained stable over the study period. Next slide. So we got really excited when we overlaid the incidence curves for dogs with those in humans for California and Arizona. There was an unbelievably close match. And in fact, the dog data for Arizona had greater fidelity than that for humans because we only had annual data for humans, whereas we had monthly data for dogs. So on the left is California and on the right is Arizona. Next slide. These are the incidence maps per 10,000 households for representative years. You can see the very high incidence in Arizona, the dark green, but also that there was an increase in incidence for counties along the northern Arizona border and also moving northwards and west of the South Central Valley of California over the study period between 2013 and 2022 shown here. We also detected reasonably high incidence in counties in Oregon, Washington, Wyoming, Idaho, and Montana. Our maps for Texas correlated well with those published in the 2013 Gortham study shown on the slide on the right, although there was some evidence of more disease activity later in the study period in North Central Texas. Next slide. All right, so I also created an incidence map that aggregated data from all study years using similar symbology to the latest map for human cases from the CDC. And in many ways, these look similar, except now we have data from states that don't report human cases. There are some gaps in the dog data as exemplified by La Paz County, circled in Arizona, which lacks dog data but is a high incidence county for humans. The population of La Paz County, however, is just over 16,000 people, compared with 4.6 million for the adjacent Maricopa County. And it turns out that most of the vet clinics in La Paz County are right on the border of La Paz County and Mojave County, and all of the tests were actually reported as coming from the adjacent Mojave County. Next slide. So our hotspot analysis identified hotspots in endemic regions that correlated with regions of known hyperendemicity for humans. You can see them there. They're nicely illustrated. Next slide. And so to wrap up, we found a high overall percentage of test positivity in dogs in this study, and test numbers and the percent of counties testing increased between 2012 and 2023. Dog incidence and spatial data correlated really nicely with known human data, and we were also able to quantify the difference in incidence among states. We found evidence of possible fungal presence in new regions in Oregon, Washington, Idaho, Montana, and Texas, and increasing incidence in existing endemic regions. Next slide. So limitations of our study include potential differences in exposure between dogs and humans, the possibility of dog travel, which we know occurs, but not to the same extent as people, and spatial and temporal variations in dog ownership. It may take longer to diagnose disease in dogs than in people, as dogs can't communicate their illness. There may also be interlaboratory variation in test results, although so far our studies suggest that this is mostly quantitative rather than qualitative. Next slide. So we are now working on correlating spatiotemporal information with climate and land cover data and improving our denominator through incorporation of more pet ownership data from the American Veterinary Medical Association. We're also working on some spatial interpolation studies to try to predict human incidence where no reporting occurs, and some active surveillance efforts in dogs in new emerging regions. Next slide. So I want to thank all the individuals that helped me with these studies at the various laboratories that provide data: the California Department of Public Health, UC Berkeley, Kansas State University, and UC Davis. Thank you very much. I'm looking forward to hearing questions.
Thank you so much, Jane. Your presentation really highlighted both aspects of a One Health approach, really, how environmental impacts can change the distribution or impact of diseases, and also presented a really interesting application of the One Health approach, where dogs are basically our canaries in the coal mine. So very neat stuff. Thank you.
Thank you.
Our final presentation, next slide, please, is the Zoonotic Influenza Reference Guide, Project Update and Revisions. And this will be presented by Dr. Meg Schaefer. So Meg, please begin when you're ready.
Thank you. Appreciate the opportunity to speak today. So as alluded to, my name is Dr. Meg Schaefer. I'm a consultant. I work on various projects with the Council of State and Territorial Epidemiologists, CDC, USDA, and then another sponsor supporter of this effort is the National Association of State and Public Health Veterinarians. Next. So the Influenza Reference Guide was actually initially developed, I believe, starting in 2021. And we actually did a ZOHU presentation in June of 2022. If you'd like to go back and see the recording, you can see the earlier iteration of the reference guide. And some of the material that I'm going to go over today, I'm not going to spend as much time on because we already did a recording doing the overview. I intend today to focus more on the updates or revisions to the guide and information that's forthcoming. Next. As far as collaborators, I mentioned the major organizations that supported this effort, both in terms of content and extensive editorial revision, and I have specific people to thank at the end. Next. So next, I'm going to spend a few minutes talking about its intended use, And then we'll go through the structure and function and content of the various sections of the reference guide. When you first get into the reference guide, you might see that it's not probably your typical epidemiologic reference guide and that it's fairly large. It's in excess of 120 pages. We have evaluated over 800 scientific reference sources, and there are over 425 references hyperlinked throughout the document. Next. Its intended use is very much focused on state and local animal and public health officials. And the purpose, as it was at the very beginning of the guide and throughout the update process, was to perpetuate or promote an understanding of flu, its history in humans and animals, to familiarize with strains, their history, to orient to surveillance resources and approaches to mitigating outbreaks. Additional references were prevention and intervention. And an important note here, content is organized by animal species. So you'll see major sections as you go through the guide, primarily focused on zoonotic infections in swine, avian, human, and sometimes cats and dogs and other species too. And you'll also see sections organized by influenza virus subtypes. There are references hyperlinked throughout. So if you want to see the origin of a statement or you want to learn more about a particular topic, you can go to that reference fairly easily. And we did try to find the most generalized resources that are publicly available for you to access in perpetuity. Next. Now we're going to go through document navigation. Next. So the first major section you'll encounter in the guide, and just a side note, the table of contents are also hyperlinked. So you can go directly to the section you want to go to fairly easily, and then you can also go back to the contents. And as we finalize the graphic design phase, as you'll see some glimpses of in this presentation, you'll see how that navigation occurs. So in this major section, the background is really focused on epidemiologists, public health officials, who might not be super familiar with flu or might just have a basic working knowledge of what flu is. So this gives a background and history of pandemics, dominant strains, human pandemics, how viruses are sequenced, nomenclature, and a little bit about the influenza risk assessment tool. Next. And this is a snapshot of the graphic designer proof, and you'll see a couple of these proofs throughout. This isn't the final iteration, but I am personally very excited that this is going to give the guide a really nice formal look, a very clean reading interface, and hopefully will allow our readers to go back to this as a very unique and concise resource in the future. Next. Here are a couple of additional pages. So this is a glimpse of the summaries that we've provided on human pandemics of the last 120 years. We wanted to include, of course, Spanish flu 1918-19 through the 2009 H1N1 pandemic. Next. The next major section in the guide is the species and strain overview. So as I mentioned previously, the guide is organized by different species groups. So avian are first in this section, followed by swine, then people, and then also by strain. So in the avian section, and you'll note this throughout this presentation today, the lines that are highlighted in green are the ones that I'll, of course, verbalize to and say that they're new, but that represents new content. So within the subsection on avian, we talk about low pathogenicity, avian influenza, and highly pathogenic avian influenza subtypes. We talk about lineage distinctions, how they're determined and differentiated. And then the new content is a section on the major outbreaks of HPAI and LPAI of the 21st century through 2019, as well as the current situation that emerged in 2020. Next. And here's some screenshots of the graphic design proof for those sections. So you can see the differentiation of the influenza types. You can see genetic sequencing examples. And we have some author-approved graphics sprinkled throughout from relevant studies and from public sources. Next. So still within the species and strain major section, here are the other sections. So we talked first about avian, then I mentioned swine. In this particular part of the guide, we have an equine section, canine and feline, bats, and influenza in other animals, of which seems to be an ever-growing list. Next. This is a screenshot of the on-graphic design edited version. So this is what the guide looks like in its current state. So this snapshot just shows some of the graphics that we utilize to show the emergence of highly pathogenic avian flu in Asia, and then the evolution of those outbreaks over time. Next. This is a graphic of the swine influenza section. It's talking about the reassortment that emerged for the pandemic strain of 2009, as well as a breakdown, as I mentioned, with the organization of the guide by type and strain, as well as animal species on the right-hand side. So in the table of contents, say you want to learn more about classical swine, avian influenza A, H1N1, you can click on that subsection and it will take you to this page 50. Next. The next major section in the guide pertains to surveillance, epidemiology, prevention, and control. We greatly expanded this section to provide additional surveillance resources and a great deal more on prevention and control. Some of the component sections underneath that, we talk about human surveillance, seasonal, novel, other respiratory pathogens, transmission dynamics, forecasting, and prevention and control. Next. Here's a snapshot of what those sections look like. So within the guide, we really try to provide references or resources that you can bookmark and go back to later so that you can refer to an improving situational awareness as you're working these types of scenarios within your own jurisdiction or just for your own knowledge base. Next. And we include international and US links as well. New content in this section centers on human cases of avian flu through 2002 and 2023. And I can confirm as soon as we're done with the graphic design review, we will make sure that all the case counts for swine and avian influenza for humans will be updated through the end of 2023. We also spend some time discussing the detections of H5N1, virus clade 234B, and also human-to-human transmission of that virus and pandemic potential. Next. Now on the prevention and control aspect of this major section. So we, of course, spend a lot of time talking about avian flu, and we, in the new content that we've added, talk a great deal about highly pathogenic avian flu, the key events, the origins of that particular outbreak, now a panzootic, its North American incursion, impact on mammals, and a myriad of resources on controlling these outbreaks in different situations. So we include resources and guidance for commercial or backyard flocks, live bird marketing systems, wildlife zoos, rehab centers, general public health monitoring of exposed persons, and state best practices from some of the wonderful participants on our work group. Next. Here's an example of some of the graphics that we have here. We're trying to do a very thorough job in illustrating the incursion of this particular virus, H5N1, into Canada and into the US. There's some great research studies on that now that help us understand how and why that happened. Next. Additional prevention and control sections, and all of this content is new. We spend more time talking about prevention and control guidelines, the transmission mechanisms between bird species, flocks, and potentially people, whether or not you can get bird flu from food, which may be a more common question than we like in the public health realm, production controls, interstate transport, and then a variety of things on outbreak prevention guidance. So once there is a detection, what actions need to be taken. We weigh in a little bit on, or at least provide content around vaccine considerations, additional prevention resources, and then again, for specific groups, how to control the highly pathogenic avian influenza outbreaks that may occur in those scenarios. Next. Here's just another graphic of the resources we've listed. As I mentioned previously, we try to provide as many hyperlinks to external sources that are reputable as possible to not overwhelm everyone with a 400-page guidance document. We felt this was the best approach. And as those guidance documents change, those links will hopefully stay somewhat static. Next. So additional sections, we'd be remiss if we forgot about swine, equine, and our other animals in prevention and control. We did not add new content, but simply revised and refreshed these sections. So we do still talk within the swine realm about epidemiology, surveillance, transmission, marketing and production systems, prevention and control. We talk about equine, flu virus, some newer outbreaks in canine, feline, and other influenza virus outbreaks. Next. We also added a new section on state best practices, which is really nice. We also revised our public health resource section and added a segment on future considerations for zoonotic flu. Next. Here's our extensive resource and contact list. So if you want to pull out specific documents, publications, you can do so in addition to the references, and also provided direct contact information for handling situations of great concern, whether it be through USDA or CDC's 24-hour line. Next. And lastly, graphic design work will be completed this spring. So I added the link, I believe it's on slide 3, to where the document's located. It's on CDC's avian influenza site. It's also within NASPHV's website. And next slide. If you have any questions on those, feel free to look at the links here. So I've linked both of those here and then also on slide 3. Next slide. And just want to spend the last moment thanking Dr. Rachel Radcliffe for her coordination of this project and the additional contributors that were part of our work group. We had a lot of people dedicate a great deal of time over the past several years on this guide, which has tremendously improved it and will hopefully make it very relevant and applicable to many. Next slide. Thank you so much.
Great. Thank you so much for sharing this guide, Meg. It's looking fantastic, and we definitely agree that this is going to be a very useful resource. Okay, so we'll move on to the Q&A section. So just a reminder to folks that links to resources from each presentation are available on our website, and that's cdc.gov/1health/zohu/2024/February.html. Before Q&A, I just wanted to thank all of today's speakers for their informative presentations, and it's looking like we do have time for a few questions. So as a reminder, if you do have questions, please use the Q&A feature in Zoom to send them. And please do include the presenter's name or topic so we know who they're going to. So let's start with a few questions for, first off, Dr. Pruden. So Dr. Pruden, we had a comment, thank you for your presentation and your work in this field. In the future, will environmental surveillance look to have a particular focus on surface or soil? And do any particular metagenomic technologies or platforms and bioinformatics platforms seem to predominate or be the most useful?
That is an excellent question. So I'll do my best to take a stab at it. So again, with monitoring antimicrobial resistance in general, the big challenge is there are many pathogens, many antimicrobial resistance genes of interest. And so one challenge is agreeing on some targets that we can focus on. And especially if our aim is to be One Health relevant. So there is a lot of attention on E. coli because we know that there are pathogenic strains. We know that E. coli antimicrobial resistance can be clinically problematic. And it is something where there are standard protocols in food and in the clinic and in the environment. And so The World Health Organization has adapted these protocols to monitor specifically for ESBL E. coli. So I think that is a promising approach. And then building the repertoire, so maybe Salmonella, Pseudomonas are talked about, Enterococci, but the challenge is culture-based work is a lot of work, and it grows exponentially. So I wouldn't rule out for sure these DNA sequencing techniques. Now they are costly and they require expertise, but I think, looking to the future, costs are decreasing. And then when you consider the costs of all the media for culturing multiple pathogens and also the human resources involved, the costs start to be more economical when you think big picture. Then also thinking about where to monitor. So again, I think thinking about locations that are relevant across One Health and get at these interfaces. I think wastewater is one that makes a lot of sense, but not just the influent sewage, but the effluent treated water that goes to the environment we're finding can be quite informative. I know the EPA is looking at their surface water quality assessment program and folding in antimicrobial resistance as something. It's an integrator. They've mapped all the watersheds and sources of livestock and wastewater. And so it really could be a sentinel for knowing what's going on with antimicrobial resistance at a national scale. And I think internationally there's similar endeavors that hopefully in the not too distant future can be coordinated.
Thank you. Okay, let's move on to a few questions for Dr. Sykes, our second presenter. So one question that we got in the chat was, is the onset of clinical signs similar in dogs and people?
Yeah, thanks for that question. I think our incidence curves, how closely they overlay, suggests that might be the case. Although a lot of dogs that are diagnosed with valley fever have disseminated disease, so that's going to take a little longer to develop. Plus, dogs can't communicate their clinical signs, so there may be a little later diagnosis, even though the onset of signs may be very similar.
Perfect, thank you. Another question for you while we have you. Are you planning any analysis or data collection around the knowledge and practices of veterinarians in areas where these cocci may be endemic in lower numbers? I suspect a low index of suspicion and testing may be underestimating incidence rates in some areas.
Yes, thank you very much for that question. We are actually already starting studies. We're actually working on a study right now with the Veterinary Information Network to reach out to veterinarians in areas that we've identified as emerging from this work presented today. So yes, we do have plans to try to understand what the awareness is in these regions, and then also try to capture data moving forward from dogs that may not have traveled from those regions.
Perfect, thank you. And maybe just one more for you. Any correlation in households between human and dog data for coccidiomycosis?
Yes, thank you for that one. Thank you, Dean Lairmore. It's good to see your name on the chat there. So yes, what we really want to do is get more granular information about dog ownership so that we can overlay that with known incidence data at a spatial level for people. And that's the really fantastic thing about this project that we're embarking on with the American Veterinary Medical Association. So excited that they're interested in helping us using economic data for One Health purposes. And that's very novel use of those data. We're extremely excited to find out where that's going to go.
Excellent, thank you. Okay, and then Dr. Schaefer, we did have a couple questions for you, but they were really around the when and where of the final zoonotic influenza reference guide, where it will be posted and when. If you could just reiterate that one more time for our audience.
Sure, happy to do that. So the links are in the presentation, but if you go to CDC's website, Influenza in Animals, scroll to the bottom of the page, there's a link to the Zoonotic Influenza Reference Guide. We expect that the guide will finish graphic design review probably April, May, and it'll be posted shortly thereafter, and we will just replace the document and the link will not change because the content is just enhanced. So the same link will work. You can access it through the CDC website, or you can go on NASPHV's website under Documents, Compendia, and then you'll see the reference guide with a recording that does an orientation similar to what we did today, and then also some slides and additional tools to help you with the guide.
Thank you so much, Meg.
Sure.
If you have any other questions for today's presenters, again, we've included their email addresses on this slide. And they'll also be on the ZOHU Calls webpage for today's webinar and in today's email letter. So lots of ways to get in contact with them. And again, a video of today's webinar will be posted within the next 30 days. Next slide, please. So we do invite you all to join us for the next ZOHU call, and that will be on March 6th, 2024. Thank you so much for your participation, everyone. This ends today's webinar.